not too bad. But those are some of the things that we're going to look at. Just jumping, we'll go to hip rotation. So I'll bring him up to 90 degrees, get him a little bit past, just loosen, relax him a little bit, and then what we're looking for, again, you're going to get about 40 to 60 degrees of external rotation. The knee determines which way the knee's going out. That's external rotation. Going in, internal rotation, you can see the asymmetry that he has. Easy rule of thumb is you should have about 45 degrees. That's an easy way to do it. Typically this is going to be about 40 to 60. This will be about 30 to 40. It's always a little tighter, but you can see what a noticeable difference he has here. This is very, very common. Most people, especially guys, are going to be very tight out here. That's where stretching this across in here is going to be very important for him to look at. It's easy to go from this position, go right up into a little bit of hamstring, okay? And normally people will start helping you and they'll really jump up and everything. Just tell them to relax, come up, see where the tension starts. This is actually pretty good. That's not too bad. Ideally, you want them to go all the way up. Not typical for guys. Females a little bit easier.
So when you internally rotate him because he's tight, well, when you do that internal rotation test, that means his external rotators are tight.
That's exactly right.
Okay.
Okay? So this is internal rotation, so it's the external rotators, the muscles that are going to pull them out, aren't allowing this to happen. Okay? You can also sort of set him down and get a sense of, okay, how tight are the adductors? This is also assessing the hip capsule in here, the anterior hip capsule that a lot of people get tight on. A lot of the older individuals are just so tight in here, it's ridiculous. But this is something that's developed over time. Okay, that's pretty good. Alright. Let's quickly take a look at this leg. This was the one where we noted a little bit of asymmetry. Alright. He's even a little bit tighter. It barely gets past neutral here. So a little asymmetry on this side. His hamstring is a little bit tighter. Okay, a little bit tighter on this side. So a couple of the tests coming up are something that we're going to look at. What I didn't look at this side, oftentimes in this position, I'll even get an assessment of how well their gastroc and soleus are working. So I'll just stabilize. I'm grabbing his ankle, just sort of pulling him forward. See if he can go into dorsiflexion, past dorsiflexion, and then as I extend out, this is going to be more of a gastroc test. And a lot of times what will happen is he's going to lose some of the dorsiflexion. He has a little bit of tightness, but it's really not that bad. So again, pretty quickly, you can do a very quick screen. So he's a little tighter on this gastroc. So you're seeing a little bit of asymmetry in him, which is very, very typical. You're going to see that in the normal population. Last thing, you can get an assessment of the low back rotation in this position as well. You bring his legs up well past 90 degrees. Now if I roll him to the side, see where he sort of stops. This is a relative left rotation of his back. Knees dropping to the right. This is the same thing as him twisting to the left. So now I'm sort of getting a sense of how much rotation he actually has in the very low back. Then we go on this side. You can see that he actually comes down a little bit further in this direction, whereas this direction, knees sort of just hang up here. So again, that's telling me that I want to go in, do a little selective testing on his low back a little bit, segmental testing, look at that a little bit. Someone has had a hip injury, you can actually distract the hip a little bit and see how much play there is. I'm actually tractioning him all the way up to his head though. As I pull, you can see, but it gives me a sense of how much he can relax as he does this. So if someone comes in with a specific complaint, a hip problem, a knee problem, an ankle problem, I might do very quickly some of these things just to get a sense of how things are, how much protection or guarding there is, but then I would go right into that joint and do a little bit of testing, maybe lateral pulling, put a little extra stress in certain directions just to check some things out, or even focus on some of the musculature around that joint. We can do an abdominal test, obviously a trunk curl. So if we're doing a trunk curl, basically what I want him to do, and obviously we got a specimen here, so we could really test him. But normal individuals, I might have him start with his arms down. Go ahead without lifting your legs. Just try to go ahead and curl up. All right, excellent. And that's a normal test to be able to do that. Now I might have him cross his arms. Go ahead and sit up again. Excellent. Now to do that, that would be 100%. Most people have fairly good upper abdominal strength. You're going to see them compensate a little bit, their legs pop up a little bit, or they give you that little lordosis and then pop up that way. That's something we want to really encourage, that curl up, to see how well they can do it. But that right there would be 100%, and that's actually pretty good. It's the lower abdominals that we typically have the problem. Now to isolate that, we use a Kendall test. Kendall was a woman who she and her husband put together a whole battery of manual muscle testing that have been very traditional in therapy. And this is her lower abdominal test, which is pretty accurate. And basically, it has to do with degrees and the ability for them to maintain a flat back, keeping a straight leg through various degrees.